Sometimes I like to check my phone. Okay. So, hello. We are live tonight. I have been looking forward to tonight since we spoke about it a while back because you are one of my favorite people in this town.
Likewise, we share the love.
Yay! And it's always been so. I've always been so grateful to be able to send families that I know to you because I know how loving and how caring and how much information they get. And it's just always, I always know that you're going to take care of everyone that I send your way. And that just fills my heart. And that's the kind of professionals that I like to work with.
Thank you.
So let's start off right away. I'm going to let you know Dr. Georgette De Jesus is a pediatric psychiatrist here in Miami. And she is part of the practice for the South Florida Integrative Medicine Group, which has two other great psychiatrists because, Dr. Ballestas, I'm also a fan. So I thought that this live would be so important because sometimes pediatric psychiatrists are the boogeymen of the pediatric world. Now I bust that myth.
Yeah, we're not that scary.
No. So I wanted to be able to, bring you on and for everybody to enjoy. So to start off, humanizing you and making you less scary. I know that you're a mom. And I want us to talk a little bit about that because this time has been very different. And I just wanted you to let everybody know, tell us the age of your children. What have you been grateful about this time and what has been difficult for you as a parent at this time?
Okay. So I have two kids. So the oldest one, which is the girl, is 7, and I have a 5-year-old boy. And of course, I think they're wonderful because they're my kids. So, so I think, I've been really grateful now with quarantine to be able to spend so much time with them because, before between work and Miami traffic, which is like famously horrible, I wasn't spending as much time as I would like to. I think I still would spend a lot of time, but maybe I would like a little bit more. So I think it's gotten us to be a little bit closer, right? And also, I don't know, like I've learned a lot about my kids. And I said this, I think the first month or two during quarantine, right? I thought to myself, this has been a time that I've learned about all these cool things that my kids think about all the time. And maybe because we're involved in the day-to-day life, like they don't necessarily tell me, right? And I'm identifying all these thought patterns and all these like really cool quirks about my kids, right? That I'm a pretty receptive mom, but I'm like, I'm really appreciating them in a whole different way. So I'm very grateful for that. And in terms of, hardships, I think everybody's stuck at home. There are times that it's hard. I think my kids have actually started getting along better. I know that's not the same case for everybody. But they've grown really close. Before they used to fight a lot. And now, it's beautiful to see how they, are kind of sticking up for each other.
Yes, of course.
Yeah. So that's really cool. But there are times that are difficult, right? If you had a super, and you might hear them every now and then.
That is what we do now. We accept dogs and children.
I know. I feel like this, like the viral interviews where the kids like come in. They're not going to come in. The door is locked, but you might hear them outside. So I think there have been things about quarantine that have been really hard for them, particularly not being able to interact as much with their friends, right, and missing all of those activities, all that social life. It's hard to keep them active. I think it was towards the beginning of quarantine, we bought a trampoline. They were like having fun. They were out. They were active all the time. And then they started being like home buddies.
Nope.
And I'm like, yeah, I kind of want them to be more active, but I had to force them to get out of the house. I think they were a little bit scared about the virus as well.
Mm-hmm.
So those things have been hard. But I think all in all, going back to being grateful, I'm pretty grateful because I think, it hasn't been as bad as maybe I expected, right? If back in March, you would tell me you're going to be stuck at home for over 6 months, right? With your kids and your husband and barely able to get out, I would be like, no, we're not surviving that.
Right. I so relate because as a working parent, that is something actually that I always tell parents I chose to be a working parent. And I've made decisions around what I do with my children and when, so I can have both of these patterns. And like you, of course, because we're like mental health professionals, I'm like, wow, I hadn't noticed that when my son tells a story, he tends to use humor when he feels uncomfortable. And I'm like, oh my God, just stop. So I so relate to that as well. And it's true. For me, the difficulty has been, just kind of honoring their flow.
Mm-hmm.
That's the other thing that I noticed. I move so much faster than everybody else in my family. And, I recognize how much of a tornado I am in like the system, So it was interesting because, my husband does the bulk of the evening routine because, like you and I, we do the same thing. We have to see families when families are available. And now that I'm here, I'm like, this runs so smoothly. I'd never witnessed it. So it was interesting.
Yeah. And aren't you more grateful? I feel like I'm more grateful about what my other half does, right?
Yes.
My husband. The poor guy, I think we've been together for a long, long time. But I'm like, okay, I took you for granted, like all these years, like all that you did, right? Because he's sort of like the main caretaker.
Yeah.
This point, and I'm like, okay, now I understand, right?
100%. So let's go into your professional side. Okay, so I've always been curious, and when I wrote down the question, I was like, wow, I've never asked her this. But tell us a bit about, why pediatric psychiatry? You went to medical school, you could have chosen any specialty. Why psychiatry and pediatric? Again,
Pediatric psychiatry. It was very unexpected, I have to say. So the psychiatry part, I knew pretty early on. I remember back in 10th grade, I was really interested in mental health and, psychiatry in general. And I even went to visit a friend of my dad's who was a psychiatrist and interviewed him and thought it was the coolest job ever. And I don't know if it was like, being a teenager, puberty, or all your friends kind of acting crazy around you. But it really interested me, sort of like how the mind works and also, what things can go wrong. So when I went into medical school, I had a pretty clear picture of what I wanted to do, right? In the middle of medical school, I mean, I like many other things. So, I doubted myself for a bit, but I ended up doing psychiatry, which I loved. But I never thought I would end up doing pediatric psychiatry because I actually, when I went to medical school, I hated pediatrics, right? And I think it was more like, the fact that I was seeing all these kids that were very sick was very hard for me, right? Where I rotated, there was also an oncology floor, and we spent a lot of time there, and it was, obviously very hard. And also when you worked with the small kids, right, that were just crying, you didn't have any idea what was going on. And I'm like, I'm trying to help them, but I don't know what's going on. I just know they're crying, they're miserable, and they have a fever. And I said, I cannot do this, for the rest of my life. So I never expected to do pediatric psychiatry. But it wasn't until my last year of doing psychiatry when I rotated in pediatric psychiatry that I fell in love with it. And I think it was that ability to connect with the kids at a very sort of raw, sort of sincere level, and sort of also like the playfulness of it, the being able to really look at their interests. Kids are very honest, right? So I appreciated that honesty and not trying to hide between a facade. So I fell in love with it, and I've never looked back. Love it.
And I am eternally grateful, and I'm sure the families that have come your way are grateful that this turn of event happened. Same here. I was going to work. When I started my master's program, even though I went in there thinking I need to know everything there is to know to how to raise my daughter, because I had my daughter and I was pregnant with my son when I got my master's program. When I went to my master's program, I was like, but I think I'm going to work in addiction. I was like, I'm nowhere near. No, I ended up in prevention, hence the parenting work. So let's get into the questions that I get most often, right? Like when would you tell a parent is a time to go get the counsel and the information from a pediatric psychiatrist? When would you think it's the time? Like, I have an opinion about it, but I want to hear what you have to say.
Okay. So, it obviously depends on what the kid is presenting. But let's talk about, for example, like a subject that you and I, discuss a lot, and we have a lot of cases in common. So with ADHD, for example, so I typically tell a parent, if you see that they're really, really struggling at school, or maybe they're not struggling, maybe they can compensate, but their self-esteem is going down, or school is bringing them a lot of anxiety because of their inability to focus or sort of organize themselves, right? Pretty much if your kid is already showing signs that they're feeling kind of miserable, it's a good time to come and visit us, right? Because I think prevention, you mentioned it before, prevention is a huge part. And it's really sad when you fast forward many years and you see a kid that has not received treatment and has been struggling all their lives, what can happen afterwards in terms of, comorbid conditions, depression, anxiety, addictions, etc. So, we want to make sure that they feel good early, and they feel good about themselves, and they feel good about school, and that they keep developing, in sort of like a nice, steady trajectory.
Yeah. And, we do talk a lot about this together with the cases that we share, but, correct me if I'm wrong, but I always tell parents, this is about brain health. Like there's a part of me, I know that there's a little tiny movement of people that want to play with language, and instead of calling it mental health, to call it brain health, because if we would only see this guy in here as the organ that it is, and yes, you're so right. So often we're only trying to change the behavior of the child, with the tutors and the ABA and the this and the that and the that, when if we just do just a little shift in certain things medically,
Exactly.
then they can have the space. That's what I always tell parents. I was like, the fact that your child that has been diagnosed with ADHD made it all the way to 4th grade, getting B's and C's, and just getting in trouble because he's constantly moving or talking to somebody, lets me know that your child works twice as hard as everybody else in that classroom. Exactly. And if we could just help them with something. Now, let's bust a myth. When a parent comes to see you, Dr. De Jesus, do you always prescribe medication?
No. So I actually, I'm pretty conservative in a good way, not in a bad way. So, I really only prescribe if I feel it's absolutely necessary, right? So if there are other steps that we can take in terms of, so instead of seeing me, maybe we should try, some therapy first. Or maybe we should try to also change some lifestyle factors, right? Or increase their exercise. Let's work on sleep, which is a big, big issue, right? That obviously affects the brain and the development. Maybe, let's look at the medical piece in terms of getting labs and making sure that they're not iron deficient or vitamin D deficient, because maybe we need to correct that. Or maybe, we can start off with some supplements. I have parents of kids with ADHD that might not be ready to medicate them. And maybe they're not failing at school. If they're failing, I'm going to say, hey, all right, this is an emergency. We need to do something right away. But if they're sort of okay, but struggling a little bit, I might say, okay, if we have some time to buy, maybe we want to try something like omega-3s, or, let's check if they have any issues with folic acid metabolism, and then treat that. So I don't always medicate at all.
Yeah. And that's a big urban myth out there. Oh, well, if I take my child to a psychiatrist, then they're going to medicate them. And actually, I think that the worst offenders is some pediatricians, right? They're quicker to give medication only because they don't have, not because they're good or they're not because they're bad. They just hear, oh, ADHD, this is kind of like, this is what is written and let's do this. And I always, and correct me if I'm wrong, whenever a child gets a diagnosis, I tend to tell parents, your pediatrician is wonderful. However, I recommend going to a pediatric psychiatrist, just like if there was something wrong, with their ears and their nose, you would go to the ear, nose, and, throat doctor. You wouldn't. So would you agree?
Partially. So I think there are some pediatricians that are fabulous and have taken, the time to get trained. And, it's never the same as a pediatric psychiatrist, obviously.
Right.
But, they're pretty judicious, and they're pretty good about sort of handling this. Some, right? Not most and not all. But I think you could argue the same about, some people in the mental health field in terms of psychiatrists. If you're seeing a psychiatrist that only really has maybe 15, 20 minutes with you, that's probably not going to be a good evaluation. And the problem is, I think you switch to a mindset at that point as a doctor. Okay, I have 15 or 20 minutes to solve this person's problem, right? How can I be most effective, and how can I make sure that, I can help them out now? And I know I'm probably not going to see them in God knows how long, right? Because of how the management system is. I have the luxury, our intakes are an hour and a half long. So I have the luxury to sit down and really talk about everything and examine everything. And, it's my private practice. So if I want to see you in a week or two, I could, right? So I think that makes a world of difference in terms of how much time you spend with a patient.
Mm-hmm. Yeah, that's definitely true. So what are the most common childhood diagnoses that you help and manage in your day-to-day?
So I do a little bit of everything, right? So the main one with kids tends to be ADHD, but also a lot of anxiety. I see a lot of generalized anxiety in kids. I see a lot of OCD, right? Even though, again, percentage-wise, it's not that common, but of course, I see a lot of cases in my office. Depression. I also see kids with autism. So I would tell you that, that's the majority of the cases that come to the office.
Right, definitely. Yeah. And I want to ask the question, Dr. De Jesus, when and if we do use medication, because we find that it may help the client, are they addictive?
No. That's a resounding no. Yeah, I love that you raised that question. And I actually, I don't know how many times I talked about that today.
Just today, right?
Well, I think that's the main fear, right? With ADHD medication, with, depression and anxiety medication, they're not addictive, right? There are other medications for, that other people use that I would never prescribe to a child. right? That could be addictive. Most ADHD medications can have, and there's a difference, right? There's the propensity for them to be addictive, right? And there's the fact that they have an abuse potential, right? So most medications for ADHD, right, are under sort of the DA's list of controlled meds, and that's why you need a doctor to really evaluate you and really oversee this, because they do have an abuse potential, which is not the same as addiction. What does that mean? That means, like everything, including caffeine, someone, if they wanted to, can take a big load of ADHD medications and get a high, right? And you can see that in college students. Some have a lot of fun with it. I've heard of like punches with some ADHD medications mixed in. But the reality is that's not how your kid, particularly if they're living with you in your house, is going to be taking their meds, right? You're going to be administering a medication with a dose that's controlled, right? And you're going to make sure that they don't take more than they should. And I have never, ever met a kid with ADHD that wants more of their ADHD medication, not because they don't like it, just because when they're on the right dose, they feel like everything clicks, right? And I can focus and I feel fine, right? Yeah. And it's not like they have a craving or I want more. No, that doesn't happen. And they've done studies with this, right? And they've tracked kids with ADHD that have been on medication since they're younger, right? Age 9 or younger. And they tracked how many of those kids versus kids that were never treated ended up abusing substances. And the kids that were never treated had a much higher chance of abusing substances and ending up addicted to other things than the kids with ADHD that have been treated. Right. And, we can think why. The kids that have been treated have better outcomes, right? Then they stay out of trouble. They do better at school. They don't drop out, right? So there are many protective factors with treating ADHD, right? If you catch it early on.
Right. And what I always tell parents is that, food, alcohol, pot, that's them sometimes just taking care of themselves. It's self-medicating. I let parents, especially in adolescence, right? If I'm anxious and I drink alcohol, which is a depressant, I'm gonna feel calm for a little bit. I mean, how many people are drinking a little wine every single night since this whole thing started? That it's a drug. All of us drink coffee in the morning to perk up. It's a drug. And so I always tell parents, hey, you're self-medicating all the time. Sugar, spikes our dopamine, right? And it spikes the yummy chemicals in our brain. That's why we eat the Entenmann's cake at night. It's like, so I always tend to tell parents that. And I have a cute anecdote. I had a little someone that, we decided together with the family that it was time to, and this little person came in to their session and they were like, I didn't know there was actually a chill pill. And I was like, do you feel chill? Yeah. I didn't know that when adults said that it was true. And it was such a beautiful moment where it was like, oh, you're actually feeling the tension and the calm.
Exactly. Yeah. And go ahead.
That's important. No, that's important. Like sometimes we rob children of that possibility. And then our brain is going to find a way to ease its tension.
Exactly.
So,
and then what I was going to say is that, when you say, okay, a kid is saying there's an actual chill pill, right? So that can be interpreted both ways. As a parent, I could say like, I'm not sure if I would love my kid saying that there's a chill pill. But if you take it in the context that it's a child that has been experiencing a tremendous amount of anxiety, right? And that has brought them a lot of dysfunctioning, particularly, at school, with friends, in their family lives. it disrupts the whole family life. The fact that they're saying there's a chill pill must mean that they were feeling so bad before, and this has made such a difference, right? That they're feeling good finally, right?
Finally.
I'm finally feeling good. And I think it's important to underscore that, right? Because sometimes, and we're both parents, and I think as a parent, I think about this as well, right? So one of my kids tends to be more anxious, way more anxious than the other. And sometimes you think, well, when is it too young? And that's beyond the topic of today. But I guess what I'm trying to say is, when your brain grows up under the stress all the time, right? Because little things, or what seems like little things to us adults, make you very anxious, and you're constantly stressed. It's not just the emotional stress. Like, our brain physically is almost bathing in stress hormone, right? Like, cortisol gets released, and that changes the way we can self-regulate our emotions. It changes the actual, structure of our brain. Our neurons start shriveling a little bit. Our memory doesn't work that well. Our frontal lobe doesn't work that well, and that's important for attention, etc. So I'm not saying that we have to medicate all of them, because actually for anxiety, we always try to use therapy first. But if you leave that unchecked, or you say, yeah, no, I don't think, they'll grow out of it. They might not, and you might have a huge problem ahead of you that started as maybe a little anxiety or a lot of anxiety, but ended up being, learning problems, low self-esteem, et cetera, et cetera, et cetera.
Yep. So I'm sure that you, just like me, have gotten tons of questions about COVID and, how to handle this time as parents. And I just want you to think about, what do you think is the most important message that you've been sharing with parents at this time? Just like that one tip that you want them to hold in mind while we're in the middle of this uncertainty, and as it pertains to their children's brain health. Let's start using that term.
All right. I think I know you're asking for one tip. I have three, but I don't think one is less important than the other.
Go for it.
Her three main ones. The first one, right? Your kid, a lot of the time, learns how to respond to things based on what they observe from you and your response, right? So if you're very stressed out because of this situation, which a lot of us are, right? Or very anxious or depressed, they're going to pick that up and they're going to react in a similar way, or they're going to think that things are really, really wrong, and this is going to end up being more traumatic, right, for them. So I think the first thing is, and you talk a lot about self-care. We need to take care of ourselves as parents, and we need to be okay for our kids to be okay. And if we're not okay, kind of fake it till you make it. Try to project that you're okay to your kid, right? So that they can feel more comfortable and be okay. So I think that's tip number one. Tip number two, quickly, teach them how to wear a mask. Right, particularly if you're thinking of sending them to school, practice with them wearing a mask, not just occasionally, but maybe before sending them, like the week before, let's wear a mask for a few hours in a row at home, right? Because otherwise, things are not going to go well.
I've been saying that one a lot.
Yeah. And then third, there are a lot of parents that are really, sort of second guessing themselves about the decision of whether to send kids to school or not, right? And for some people, it's not an option, right? Some people do need to send their kids to school because of their work. Some people, because of, who lives with them, their risk factors, can't send their kids to school and they have to stay at home. But I would say for all of you that are in the fence, right? It's important to focus on what's right for you and your family, and not so much about what you think other people are gonna think, right? Make sure, obviously, that the school has a very safe plan in terms of returning, right? It's not like we're gonna send them out, like we say in Spanish, a lo loco. Yeah. Yeah. Make sure you're comfortable with their plan, and train your kids as well as you can to, again, wear their masks, practice some. I don't like social distancing. I don't like that term. Like physical distancing.
Yeah.
Yeah. And we can just hope for the best. But again, it's your personal decision. Don't let it be influenced by all this pressure that you're getting from everybody.
So much pressure right now for families, and it's an incredibly difficult decision to make. And yes, I've been giving similar points, the whole idea of we are the secure base for our babies. Is something important. I think in the beginning of the pandemic, I kind of painted a picture of we are in a fish tank, right? And the parents are the water and the children are the fish. And how healthy is your water? Just kind of
I love that.
think about that, and so and then you kind of feel it like, oh, and also, I want to give parents an out, you are their secure base. And sometimes we can say, hey, mommy's feeling a little sad today, but I'm going to read and I'm going to wash my face and I'm going to cry a little bit. But, so it's okay if we share how we're feeling, as long as we tell them how we're taking care of ourselves. It's not like, I'm sad because you don't listen, and then now it's their responsibility to take care of your sadness. Exactly. Or their responsibility to take care of your frustration. And it's really hard right now. This thing has been a master class for everyone to manage uncertainty, to manage, decision making, right? So it's so funny. Robin is so sweet. Robin, she's been writing. Thank you, Robin. And I love you too. In the thread. So what didn't I ask you that I should have, that you think, we could end with that, the final deep thoughts?
Lina, I don't know. I really don't know. I don't know the time of day for anyone that's going to listen to this at another time. It's 8:30 at night. So I don't know if, I'm just wiped out from the day. I think one thing I want to stress, super stress, right? And is the importance of exercise, right? And it might be kind of like a weird closing, statement. Maybe should have talked about this a little bit before, but I cannot stress enough how important, right? Particularly now that we're indoors, is outdoor exercise for you as a parent and for your kids. And if you can do it together, that's beautiful, right? Even better. But you need to make sure your kids are moving. Again, these little brains are developing, right? The more we move, the more exercise we do, the more of a protein actually called brain-derived neurotrophic factor gets released. And that sounds like, it's a very long name. But basically what it means, it's a substance that makes sure that your brain cells are sort of growing and connecting appropriately, right? So really, if we stop exercising, because kids are not as physically active right now, right? If they're indoors, our little cells can start shriveling up a little bit. So exercise is super important. So please don't let that pass. Keep your kids active. Keep yourself active. Everybody's going to feel better, right? Hopefully, if we do it outside, we get enough vitamin D. That also helps us feel better. So, you know, I think that's one of the main things that I wanted to say. But I don't know. I don't know. Do you have any other questions?
That's it. I think that we have taken you out of the scary monster closet. You're not the boogeyman. You're a beautiful.
Yes. Yeah.
You are just as loving and just as supportive, and parents do not have to be afraid of going to the pediatric psychiatrist, and especially if they're going to you, Dr. De Jesus. I want to thank you for saying yes to this little late night interview, and I look forward when I get to hug you again.
I know. I know. I miss hugs.
I miss hugs too.
So thank you so much for inviting me. You know, I love you as well. We're like love sharing you. Yeah, you're awesome. You're awesome at what you do, and thank you so much for helping parents through this journey. What you do is super important. So thanks for being, you know, one of my buddies.
Yay! So everybody, thank you for joining us tonight. If you're watching it at another time, hope that this was helpful. And until next time.
All right. Bye.
Bye.